I went to Middle East, Sultanate of Oman, and worked as a specialist for about 10 years. So, wherein I had a vast experience in trauma mainly and emergency surgeries. From there, in 2019 till today, I am in Yadgir in VBR Mudnal hospital as a specialist of surgery. The idea of starting this hospital was to give this town a comprehensive health care and the best facilities available in the town. So we started it initially as a 30-bedded hospital, but by the time the structure came in, it had become a 60-bedded hospital. So from 60, it increased to 100. Basically started by my brother-in-law, Basavaraj Mudnal, after whom this hospital name is VBR Mudnal, stands for Veer Basavaraj Mudnal Hospital. It is a really very well-equipped hospital. We have got one minor OT, three major OTs, all for different specialities like gynec, OBG, orthopedics, where they can do routine orthopedic surgery as well as joint replacements, because we have made it as an absolute modular OT. And then there is another OT for general surgery, ENT, ophthalmology, other branches too. Probably we are giving one of the best services available in this town. This is a population of around 1.5 to 2 lakhs population town, Yadgir. And this being one of the hospitals, there are a lot of hospitals, but our hospital is the biggest hospital available. Then my son, who is an orthopedician, Dr. Amog, he gave me an idea as to contact CIPACA to take care of that hospital's ICU, because it was lying idle for last 3 years since inception. So once I thought it may work, it might not work, because I had an idea as to ICU running, remote ICU running, or a cloud physician, something of that sort. So I thought even CIPACA is that. Once I contacted the human resources, the people who are in CIPACA, especially Dr. Raja Marnath, Ms. Upasana, Dr. Ashwati, Dr. Shirisha, Mahesh, Ida, Dr. Miss Shirley, all these people. Then I came to know the concept of rural ICU, wherein they'll really man the ICU and cater to the emergencies that are needed to be addressed in a rural health setup. This was one of its kind, because earlier I had never known of this concept. So that is why we have taken the help of CIPACA people. We will settle well in form of treating the emergencies that need to be addressed and save the time that is wasted in referring the patients from this town to the nearest better facility available, or tier 2 level cities and their hospitals. Before CIPACA, we used to get patients who are general surgery, orthopedics, or obs and gynae. But after CIPACA, a lot of people, medicine people, have started dropping in. Emergencies, though, definitely they are managing it very well. Apart from that, normal cases which a physician should handle, and surgical patients who otherwise, due to their comorbidities, which we used to refer it to the tier 2 cities like Gulbarga and Raichur, they have been started being managed in our hospitals because of CIPACA. The only one which full-fledged ICU, which absolutely manned by faculties, specialties in form of doctors, nurses, administration and PRO, we are the only ones we have. As a professional ICU, ours is the only one, and that too it is with CIPACA. Yeah, I have one story which I remember vividly. There's a fair which runs every year, a month in Yadgir. People from different parts of the country bring their own products, like say footwears, carpets, carpentry miniatures, everything, and they do that exhibition for a month, and they make their living and take that, and next month they go to the next nearest town available. One of those gentlemen who had come as a seller in that, he was a chronic smoker. He came suddenly with breathlessness and his saturation was down, so they straight away brought here. Hearsay, word of mouth, they came to know there's a big hospital, so they came in. And once the patient came in, because I don't understand medical emergencies, I simply called the staff, which was immediately rushed down in less than a minute, and they said that this patient is having cardiac asthma, that is a pulmonary edema sort of thing, which his whole lungs were pulled with fluid. I don't know the reasons, so I could only hear crepitations on auscultation, and his saturation was less than 70. They put him on an IV line, draw blood for his basic investigations, and first thing they did was they maintained his airway. They made it patent by intubating him. Once patient was intubated, his saturation started increasing. Later on, whatever is the protocol that CIPACA does, which I don't interfere and I don't know, they manage the case. On 5th day, he was shifted to general ward. On 7th day, he went walking from this place. Then later on to cardiology, basically like cath labs, interventional cardiologies. This is the one. Then before that, I would like to also start vascular surgeries, like emergencies like thromboembolism, then routine surgeries like varicose veins, lasers, who might end up, not sure, with embolism. Such cases also can be managed. Wherein there is a think tank that is there available in Chennai, sitting 24/7 to give their second opinions as to what best can be done, what has to be done in future, as a precaution, everything. For that, the overheads and the charges for the ICU patients and the beds as it is, for them, when compared to the tier 2 level cities, towns nearby, it is much lesser, almost 1/3. That is what I think.